Good day, everyone. For today's topic, we will be talking about the circulatory system. Upon successful completion of this chapter, the reader should be able to identify the layers and other structures of the heart and describe their function. Describe the cardiac cycle and how an ECG tracing relates to it, and explain the origins of heart sounds and pulse rates. We will also identify the two main divisions of the vascular system, describing the function of each, and trace the flow of blood throughout the system. Identifying the different types of blood vessels and describe the structure and function of each. We will also be naming and locating major arm and leg veins and describe the suitability of each for venipuncture. The circulatory system consists of the cardiovascular system, heart, blood, and blood vessels. The circulatory system class is the means by which oxygen and food are carried to the cells of the body. It is also the means by which carbon dioxide and other waste are carried away from the cells to the excretory organs. This system also aids in the coagulation process, assisting in defending the body against disease, and plays an important role in the regulation of body temperature. The heart is the major structure of the circulatory system. It is the pump that circulates blood throughout the body. It is located in the center of the thoracic cavity between the lungs, with the apex pointing down to the left of the. The heart is a four-chambered, hollow muscular organ, slightly larger than a man's closed fist. It is surrounded by a thin, fluid-filled sac called the pericardium, and its walls have three distinct layers. The heart has two sides, a right and a left. Each side has two chambers, an upper and a lower. One-way valves between the chambers help prevent the backflow of blood and keep it flowing through the heart in the right direction. The right and left chambers are separated from each other by partitions called septa. There are three layers of the heart. One is the epicardium. This is a thin, serous, watery membrane that is continuous with the lining of the pericardium. This is the outer part of the heart, which covers the heart and attaches to the pericardium. Next is the myocardium. This is the thick layer of cardiac muscle that helps in contracting to pump the blood into the artery. And the inner layer of the heart is what we call the endocardium. This is lined with a thin layer of epithelial cells that is continuous with the lining of the blood vessels. This lines the interior chambers and the valves of the heart. The upper chambers on each side of the heart are called atria, and the lower chambers are called ventricles. The atria are the receiving chambers, while the ventricles are the pumping or the delivering chambers. The right atrium, this receives the oxygenated blood from the body via the superior vena cava and the inferior vena cava, and pumps it into the right ventricle. The right ventricle receives blood from the right atrium and pumps it into the pulmonary artery, which carries it to the lungs to be oxygenated. The left atrium is the one receiving the oxygenated blood from the lungs via the pulmonary veins and pumps it into the left ventricle. The left ventricle receives blood from the left atrium and pumps it into the aorta. The walls of the left ventricle are nearly 3 times as thick as the right ventricle, owing to the force required to pump the blood into the arterial system. Let's now discuss the different valves. The valves at the entrance to the ventricles are called atrioventricular valves. It consists of two different valves that is called the mitral valve, or otherwise known as the bicuspid valve, and also the tricuspid valve. The valves that exit the ventricles are called semilunar valves because they are crescent shaped like the moon. The valve that is found at the entrance to the aorta is what we call the aortic valve, while the one that gives entrance to the pulmonary artery is what we call the pulmonary valve or the pulmonic valve. Let's discuss these valves one by one. The right atrioventricular valve, also known as the tricuspid valve, is found between the right atrium and right ventricle. This closes when the right ventricle contracts and prevents blood from flowing back into the right atrium. This is called tricuspid because it shows three cups or. The left atrioventricular valve, also called as the bicuspid or the mitral valve, closes when the left ventricle contracts and prevents blood from flowing back into the left atrium. The term mitral valve comes from its resemblance to a mitre, the pointed, two-sided hat worn by bishops. The right semilunar valve is also called the pulmonary or the pulmonic valve. It closes when the right ventricle relaxes and prevents blood from flowing back into the right ventricle. This is found at the entrance to the pulmonary artery and has three half-moon-shaped cusps, while the other three half-moon-shaped cusps that is found at the entrance to the aorta is what we call as the left semilunar valve, or otherwise known as the aortic valve. This closes when the left ventricle relaxes and prevents blood from flowing back into the left ventricle. For your information, the atrioventricular valves are attached to the walls of the ventricles by thin threads of tissue called the chordae tendineae, which keeps the valves from flipping back into the atria. More information. There are two partitions separating the right and left sides of the heart. The partition that separates the right and left atria is called the interatrial septum. The partition that separates the right and left ventricles is called the interventricular septum. Each septum consists mostly of myocardium. The heart muscle does not receive nourishment or oxygen from blood passing through the heart. It receives its blood supply via the right and left coronary arteries that branch off of the aorta, just beyond the aortic semilunar valve. Partial obstruction of a coronary artery or one of its branches can reduce blood flow to a point where it is not adequate to meet the oxygen needs of the heart muscle, a condition called myocardial ischemia. While the complete obstruction or prolonged ischemia leads to myocardial infarction or heart attack. This is because there is already necrosis or death of the surrounding tissue caused by a lack of oxygen. For your information, fatty plaque buildup from a condition called atherosclerosis can lead to severe narrowing of coronary arteries. This condition is sometimes treated using a coronary bypass procedure, and in this surgical procedure, a vein, commonly the saphenous vein from the leg, is grafted onto the artery to divert the blood around the affected area. Let's proceed to the heart's function. One complete contraction and subsequent relaxation of the heart lasts about 0.8 seconds and is called a cardiac cycle. The contracting phase of the cardiac cycle is what we call the systole, and the relaxing phase is the diastole. To be effective at pumping blood, the heart contractions must be synchronized or coordinated so that both atria contract simultaneously, followed by contraction of both ventricles. Synchronization is achieved by means of specialized muscle cells that form the electrical conduction system. Instead of contracting, these cells act like nerve tissue in that they initiate and distribute electrical impulses throughout the myocardium to coordinate the cardiac cycle. The specialized tissues create an electrical conduction system pathway and include two tissue masses called nodes and a network of specialized fibers that branch throughout the myocardium. Heart contraction is initiated by an electrical impulse generated from the sinoatrial node or SA node, or also called the pacemaker. This is found at the start of the pathway. The sinoatrial node class begins the heartbeat by generating the electrical pulse that travels through the muscles of both atria, causing them to contract simultaneously and push blood through the atrioventricular valves into the ventricles. While in the walls of the right atrium, the internodal pathway fibers are found. They relay the impulse to the atrioventricular or AV node. The atrioventricular node class is found at the bottom of the right atrium in the interatrial septum. This picks up the impulse, it slows it down while the atria finish contracting, and then relays it through the AV bundle or commonly known as the bundle of His. This bundle of His relays impulse throughout the ventricular walls by means of bundle branches and Purkinje fibers. This causes the ventricles to contract, forcing blood through the semilunar valves. Both atria and ventricles relax briefly before the entire cycle starts again. This atrioventricular node or the bundle of His is found at the top of the interventricular septum. For more information, the SA node is called the pacemaker because it sets the basic pace or rhythm of the cardiac cycle. Can be recorded by means of an electrocardiogram. That is an actual record of the electrical currents that correspond to each event in heart muscle contraction. The recording is called an ECG tracing. Heart contractions are recorded as waves when electrodes are placed on the skin. So those LEDs or wires that are placed on the skin class. The P wave of the tracing represents the activity of the atria and is usually the first wave seen. The QRS complex, so that is a collection of three waves, along with the T wave, represents the activity of the ventricles. An ECG is useful in diagnosing heart muscle damage and abnormalities in heart. Let's start from the P wave. P wave symbolizes atrial depolarization, meaning both the atria are contracting. For QRS complex class, this shows ventricular depolarization, meaning both the ventricles of the heart are contracting. Can you see the spike over here? So just imagine that that is an inverted V, which stands for the ventricles. So for QRS complex, this signifies that the ventricles are contracting. Well, along with the QRS complex, That is the T wave. This represents ventricular repolarization. This means that the ventricles of the heart are relaxing. Remember always, class, that for every depolarization, there should always be a repolarization. Being said, it means that for every contraction, there should always be a relaxation. As the ventricles contract, or the systole, the atrioventricular valves close, resulting in the first sound, that is a long, low-pitched sound commonly described as a lub, while the second sound comes at the beginning of ventricular relaxation, or the diastole, and is due to the closing of the semilunar valves. This one, it is shorter and sharper and described as a tup. Abnormal heart sounds are called murmurs and are often due to a faulty valve action. The heart rate is the number of heartbeats per minute. Normal adult heart rate averages 72 beats per minute. The volume of blood pumped by the heart in 1 minute is called the cardiac output and averages 5 liters per minute. An irregularity in the heart rate, rhythm, or beat is called an arrhythmia. A slow rate, less than 60 beats per minute, is called bradycardia, while a fast rate over 100 beats per minute is called tachycardia. Extra beats before the normal beat are called extrasystoles, while the rapid, uncoordinated contractions are called fibrillations and can result in lack of pumping. The pulse is the palpable rhythmic throbbing caused by the alternating expansion and contraction of an artery as a wave of blood passes through it. It is created as the ventricles contract and blood is forced out of the heart and through the arteries. In normal individuals, the pulse rate is the same as the heart rate. The pulse is most easily felt by compressing the radial artery on the thumb side of the wrist. Blood pressure is a measure of the force or pressure exerted by the blood on the walls of the blood vessels. It is commonly measured in a large artery, such as the brachial artery in the upper arm, using a sphygmomanometer, more commonly known as a blood pressure cuff. Blood pressure results are expressed in millimeters of mercury and are read from a manometer that is either a gauge or a mercury column depending upon the type of blood pressure cuff used. The two components of blood pressure measured are: systolic pressure is the pressure in the arteries during contraction of the ventricles. Diastolic pressure is the arterial pressure during relaxation of the ventricles. For your information, a blood pressure reading is expressed as the systolic pressure over the diastolic pressure. Average normal blood pressure is verbally expressed as 120/80 and is written as 120/80. Just always remember the mnemonics that systole is S and represents sky, while diastole is D and represents dirt. Sky is always above dirt. So systole over diastolic pressure. The brachial blood pressure reading is taken by placing a blood pressure cuff around the upper arm and a stethoscope over the brachial artery. The cuff is inflated until the brachial artery is compressed and the blood flow is cut off. Then, the cuff is slowly deflated until the first heart sounds are heard with the stethoscope. The pressure reading at this time is the systolic pressure. The cuff is then slowly deflated until a muffled sound is heard. The pressure at this time is the diastolic pressure. The different heart diseases. Angina pectoris, also called as ischemic heart disease, has a pain on exertion caused by inadequate blood flow to the myocardium from the coronary arteries. Bacterial endocarditis is an infection of the lining of the heart, most commonly caused by a streptococci. Congestive heart failure has an impaired circulation caused by inadequate pumping of a diseased heart, resulting in fluid buildup or what we call as edema in the lungs or other tissues. For pericarditis, this has an inflammation of the pericardium. Myocardial infarction is a kind of heart attack or death of heart muscle due to obstruction or occlusion of a coronary artery. Aortic stenosis is a narrowing of the aorta or its opening. Myocardial ischemia has an insufficient blood flow to meet the needs of the heart muscle. Here are some of the examples of diagnostic heart tests, but there are still more. So, we have arterial blood gas. Usually, this is run in the laboratory, but the collection and extraction of this type of specimen is done by respiratory therapists. Next is aspartate aminotransferase or serum glutamic oxaloacetic transaminase. Actually, class, both of these are the same, but due to new and old transcription of names, that's why they have an AST or SGOT. So just don't be confused, both of these have the same meaning. Another one is to test for cholesterol, creatine kinase, CKMB, this is a cardiac marker, digoxin, have an ECG tracing, lactate dehydrogenase isoenzyme testing, microbial cultures to test for pericarditis, myoglobin, potassium, triglycerides, and troponin I or troponin T. Before we proceed, let's have a brief recap from Mayo Clinic.
The center in your chest. Your heart is divided into the right and left side. The division protects oxygen-rich blood from mixing with oxygen-poor blood. Together, your heart and blood vessels comprise your cardiovascular system, which circulates blood and oxygen around your body. In fact, your heart pumps about 5 quarts of blood every minute, and it beats about 100,000 times in one day. That's about 35 million times in a year. Oxygen-poor blood, blue blood, returns to the heart after circulating through your body. The right side of the heart, composed of the right atrium and ventricle, collects and pumps the blood to the lungs through the pulmonary arteries. The lungs refresh the blood with a new supply of oxygen, making it turn red. Oxygen-rich blood, red blood, then enters the left side of the heart, composed of the left atrium and ventricle, and is pumped through the aorta to the body to supply tissues with oxygen. 4 valves within your heart keep your blood moving the right way. The tricuspid, mitral, pulmonary, and aortic valves work like gates on a fence. They open only one way and only when pushed on. Each valve opens and closes once per heartbeat, or about once every second. A beating heart contracts and relaxes. Contraction is called systole, and relaxing is called diastole. During systole, your ventricles contract, forcing blood into the vessels going to your lungs and body, much like ketchup being forced out of a squeeze bottle. The right ventricle contracts a little bit before the left ventricle does. Your ventricles then relax during diastole and are filled with blood coming from the upper chambers, the left and right atria. Then the cycle starts over again. Your heart is nourished by blood too. Blood vessels called coronary arteries extend over the surface of your heart and branch into smaller capillaries. Here you can see just the network of blood vessels that feed your heart with oxygen-rich blood. Your heart also has electrical wiring, which keeps it beating. Electrical impulses begin high in the right atrium and travel through specialized pathways to the ventricles, delivering the signal to pump. The conduction system keeps your heart beating in a coordinated and normal rhythm, which in turn keeps blood circulating. The continuous exchange of oxygen-rich blood with oxygen-poor blood is what keeps you alive.
Let's proceed to the vascular system. This is the system of blood vessels that, along with the heart, form the closed system by which blood is circulated to all. There are two main divisions to this system: the pulmonary and the systemic circulation. The pulmonary circulation carries blood from the right ventricle of the heart to the lungs to remove carbon dioxide and pick up oxygen, and returns oxygenated blood to the left atrium of the heart. The oxygenated blood from all body parts enters into the vena cava, which supplies it to the right atrium of the heart. From the right atrium, the blood enters the right ventricle, which forces it into the lungs through the pulmonary artery. Inside the lungs, the artery divides several times to form microscopic pulmonary capillaries that surround alveoli of the lungs. At this point, carbon dioxide from the deoxygenated blood is forced into the alveoli for exhalation, and inhaled oxygen from the alveoli enters the capillaries. Capillaries then combine to form the pulmonary vein. Pulmonary vein carries the oxygenated blood from the lungs to the left atrium of the heart. From here, the blood enters the systemic circulation. The systemic circulation serves the rest of the body, carrying oxygenated blood and nutrients from the left ventricle of the heart to the body cells and returning to the right atrium of the heart with blood that is carrying carbon dioxide and other waste products of metabolism from the cells. This is the part of our circulatory system that involves blood circulation between the heart and the whole body. Oxygenated blood from the left atrium enters into the left ventricle. Left ventricle then pumps the blood into aorta with high force. This is the reason why the left ventricle is 3 times thicker than that of the right ventricle. The aorta then divides into several arteries that carry the pure blood to all body parts. Arteries divide to form arterioles. At the cellular level, arterioles divide to form microscopic systemic capillaries that supply blood to each and every cell of the body. Oxygen from the blood diffuses into the cells, whereas carbon dioxide generated as a result of metabolism enters into the capillaries. Capillaries, or otherwise known as venules, combine to form veins, and veins combine to form the vena cava, which is the superior and the inferior vena cava. The carbon dioxide-rich blood or deoxygenated blood from capillaries enters into veins and from there into the vena cava. The vena cava pours it into the right atrium, ready to be filled again with oxygen from the pulmonary circulation. And so, the cycle continues. The structures of the vascular system are the various blood vessels that, along with the heart, form the closed system for the flow of blood. Blood vessels are tube-like structures capable of expanding and contracting. There are 3 types of blood vessels: the arteries, veins, and capillaries. Let's start first with the arteries. These are blood vessels that carry blood away from the heart. They have thick walls because the blood that moves through them is under pressure from the contraction of the ventricles. This pressure creates a pulse that can be felt, distinguishing them from the veins. Systemic arteries carry oxygen-rich blood away from the heart to the tissues. Because it is oxygenated or full of oxygen, normal systemic arterial blood is bright cherry red. For your information, When arterial blood is collected by syringe, the pressure normally causes the blood to pump or pulse into the syringe under its own path. More in The pulmonary artery is the only artery that carries deoxygenated or oxygen poor blood. It is part of the pulmonary circulation and carries deoxygenated blood from the heart to the lungs. It is classified as an artery because it carries blood away from the heart. Additional information. The smallest branches of arteries that join with the capillaries are called arterioles. The largest artery in the body is the aorta. It is approximately 1 inch or 2.5 centimeters. Let's proceed to the veins. These are blood vessels that return blood to the heart. Veins carry blood that is low in oxygen or deoxygenated or oxygen poor, except for the pulmonary vein, which carries oxygenated blood from the lungs back to the heart. Because systemic venous blood is oxygen poor, it is much darker and more bluish red than normal arterial blood. The walls of the veins are thinner than arteries because the blood is under less pressure than arterial blood. Since the walls are thinner, veins can collapse more easily than arteries. Blood is kept moving through veins by skeletal muscle movement, valves that prevent the backflow of blood, and pressure changes in the abdominal and thoracic cavities during breathing. The smallest veins at the junction of the capillaries are called venules. The largest veins in the body are the vena cava. The longest veins in the body are the great saphenous veins in the leg. Capillaries are microscopic, one-cell thick vessels that connect the arterioles and venules, forming a bridge between the arterial and venous circulation. Blood in the capillaries is a mixture of both venous and arterial blood. In the systemic circulation, arterial blood delivers oxygen and nutrients to the capillaries. The thin capillary walls allow the exchange of oxygen for carbon dioxide and nutrients for waste between the cells and the blood. Carbon dioxide and wastes are carried away in the venous blood. In the pulmonary circulation, carbon dioxide is delivered to the capillaries in the lungs and exchanged for oxygen. Network of arteries, veins, and capillaries form the pathway for the flow of blood throughout the body that allows for the delivery of oxygen and nutrients to the body cells and the removal of carbon dioxide and other waste products of metabolism. The blood vessel structure. Arteries and veins are composed of three main layers. The thickness of the layers varies with the size and type of blood vessel. In this picture class, this shows a cross-section of an artery and a vein as seen under a microscope. Capillaries are composed of a single layer of endothelial cells and enclosed in a basement membrane. Let's start from the outer layer of this blood vessel. You call that tunica adventitia. This is sometimes called the tunica externa. This layer is made up of connective tissue and is thicker in arteries than in veins. The middle layer of a blood vessel is called the tunica media. This one is made up of smooth muscle tissue and some elastic fibers. It is much thicker in arteries than in veins. Lastly, the tunica intima, which is found at the innermost layer or lining of a blood vessel, which is sometimes called the tunica interna. It is made up of a single layer of endothelial cells with an underlining basement membrane, a connective tissue layer, and an elastic internal membrane. The lumen is the internal space of a blood vessel through which the blood flows. Venous valves are thin membranous leaflets composed primarily of epithelium similar to the semilunar valves of the heart. Most of the venous system is flowing against the pull of gravity. As blood is moved forward by skeletal muscle movement, for example, the valves help keep it flowing toward the heart by allowing blood flow. The presence of valves within veins is a major structural difference between artery phlebotomy related vascular anatomy. The major veins for venipuncture are located in the arm in what is referred to as the antecubital fossa. This is the area of the arm that is anterior to, that means in front class, in front of, and below the bend of the elbow. Several major arm veins lie close to the surface in this area, making them easier to locate and penetrate with a needle. These major superficial veins are referred to as antecubital veins. Anatomic arrangement of antecubital veins varies slightly from person to person. However, two basic vein arrangements referred to as the H and M shape patterns are most often seen. The vein distribution patterns are so named because the major antecubital veins on the arm resemble the shape of either an H. Let's be familiarized first with the H-shaped antecubital veins. This H-shaped vein distribution pattern is displayed by approximately 70% of the population and includes the median cubital vein, cephalic vein, and the basilic vein. The median cubital vein class is located near the center of the antecubital area. It is the preferred vein for venipuncture in the H-shaped pattern. This one is typically larger, closer to the surface, and more stationary than the others, making it the easiest and least painful to puncture and the least likely to bruise. The cephalic vein is located in the lateral aspect of the antecubital area. This is the second choice of vein for venipuncture in the H-shaped pattern. It is often harder to palpate than the median cubital, but it's fairly well anchored and often the only vein that can be palpitated or that can be felt in obese patients. The large vein located on the medial aspect, the one on the inner side of the antecubital area, it is the last choice vein for venipuncture in either vein distribution pattern. This one is called the basilic vein. It is generally easy to palpate but is not as well anchored and rolls more easily, increasing the possibility of accidental puncture of the anterior or posterior branch of the medial cutaneous nerve. So this medial cutaneous nerve class is a major arm nerve or the brachial artery, which both commonly underlie this area in the basilic vein. Punctures in this area also tend to be more painful and easily bruised. So just remember class that when you say basilic vein, B stands for body, so meaning it's B, body, closer to the body. The basilic vein is the vein found closer to the body. While so that you can remember cephalic vein, sinisipa mo siya. So that's away from the body. The cephalic vein is found away from the body. Let's discuss further the veins that form the M-shaped vein distribution pattern. This includes the cephalic vein, intermediate cephalic vein, intermediate antebrachial vein, intermediate basilic vein, and basilic vein. The veins most commonly used for venipuncture in this distribution pattern are described as follows. The intermediate antebrachial vein, which is also commonly referred to as the median vein, is the first choice for venipuncture in the M-shaped pattern because it is well anchored. This one tends to be less painful and is not as close to major nerves or arteries as the others, making this vein, the intermediate antebrachial vein, generally safest to puncture. The intermediate cephalic vein, also known as median cephalic vein, this one is the second choice for venipuncture in the M-shaped pattern because it is accessible and is for the most part located away from major nerves or arteries, making it generally safe to puncture. This one this one is less likely to roll and relatively less painful to puncture. And lastly, the intermediate basilic vein, commonly referred to as the median basilic vein. This one is the third choice, even though it may appear more accessible, but this one is more painful and is located near the anterior and posterior branch of the medial cutaneous nerve. Vein location may differ somewhat from person to person, and you may not see the exact textbook pattern. The important thing to remember is to choose a prominent vein that is well fixed and does not overlie a pulse, which indicates the presence of an artery and the potential presence of a major nerve. According to the Clinical and Laboratory Standards Institute, although the larger and fuller median cubital and cephalic veins are used most frequently, veins on the back of the hand and wrist are also acceptable for venipuncture. Because of the potential for significant medical complications such as phlebitis or thrombosis, leg, ankle, and foot veins must not be used for venipuncture without permission of the patient's physician. Puncture of the femoral vein is performed only by physicians or specially trained personnel. Let's say, for example, if the patient has diabetes, then you must never use the leg or the ankle or the foot veins for venipuncture as they have more they are more susceptible to infections and the possibility. This is not only limited to diabetic patients class. This also includes to patients who have cardiac problems, coagulation problems, so either this patient has a more risk of bleeding or clotting, those types of complications. The arteries too can be a site for venipuncture, but you call this one as arterial puncture. This requires special training to perform, is more painful and hazardous to the patient, and is generally limited to the collection of arterial blood gas specimens. These ABG class specimens are for the evaluation of respiratory function. Arterial puncture for ABG collection will be explained to you sooner in your next topic. The most common site for arterial puncture is the one found on your radial artery below your thumb near the wrist. So that is the most common site for our. Let's talk about the different vascular system disorders. Number one, we have aneurysm. This is a localized dilation or bulging in the wall of a blood vessel, usually an artery. Arteriosclerosis is the thickening, hardening, and loss of elasticity of artery wall. Atherosclerosis is a form of arteriosclerosis involving changes in the intima of the artery due to accumulation of lipids, and so on. Embolism is the obstruction of a blood vessel by an embolus. An embolus is a blood clot a part of a blood clot or other mass of undissolved matter circulating in the bloodstream. Phlebitis, this is an inflammation of a vein. Hemorrhoids, these are varicose veins that is found in the rectal area. Thrombophlebitis is an inflammation of a vein along with thrombus or a blood clot formation. A thrombus is a blood clot in a blood vessel. Varicose veins or varices is a swollen, knotted superficial veins. Lastly, these are just some of the examples of vascular system tests that can be done in the laboratory. You can request for a disseminated intravascular coagulation screen. So this will check if the patient has any coagulation that has happened anywhere in the body. So this one screens for that type of disorder. The patient may also be tested for lipoproteins, prothrombin time, partial thromboplastin time, or activated partial thromboplastin time, that's PTT or APTT, activated partial thromboplastin time. And lastly, for triglycerides, so checking for cholesterol, triglycerides, HDL and LDL, the good and the bad cholesterol. So let's now proceed to the blood. The blood has been referred to as the river of life, flowing throughout the circulatory system, delivering nutrients, oxygen, and other substances to the cells, and transporting waste products away from the cells for elimination. The blood is a mixture of fluid and cells that is about 5 times thicker than water, salty to the taste, and slightly alkaline with a pH of about 7.4. You write this down. pH is the degree of acidity or alkalinity on a scale of 1 to 14, with 7 being neutral. So with a pH of 7.4, the blood is slightly alkaline. In vivo, or in the living body, or inside the human body, the fluid portion of the blood is called plasma. So the yellowish color fluid inside is called the plasma. And the cellular portion is referred to as the formed elements. Those were the red blood cells or the erythrocytes, white blood cells or the leukocytes, and the blood platelets. The plasma is approximately 55%, while the 45% is for formed elements. The average adult weighing 70 kilograms, approximately 154 pounds, has a blood volume of about 5 liters or 5.3 quarts. Accordingly, approximately one half of a blood specimen will be serum or plasma, depending on the anticoagulant or the tube used, and the other half will be blood cells. The erythrocytes or red blood cells are the most numerous cells in the blood, averaging 4.5 to 5 million per cubic millimeters of blood. Their main function is to carry oxygen from the lungs going to the cells, and they also remove the waste and carry carbon dioxide from the cells back to the lungs to be exhaled. The main function of the WBCs is to neutralize or destroy pathogens, while the platelet, also known as the thrombocytes, are the smallest of the formed elements and is responsible for the coagulation or the blood clotting process. Testing personnel typically prefer specimens that contain roughly 2.5 times the amount of sample required to perform the test, so the test can be repeated if needed, with some to spare. Consequently, a test that requires 1 ml of serum or plasma would require a 5 ml blood specimen because only half the specimen will be fluid, while a test that requires 1 ml of whole blood would require a 2.5 milliliters of specimen. Thank you for listening to this very long lecture. I hope that you stay healthy, eat healthy foods, have a regular routine exercise, and avoid smoking and constant drinking. I hope you make good choices. Stay safe out there. See you soon. That would be all for the cardiovascular system.